Again, a nice little study guide in case you want a quick reference of the terms that we went through. Next thing I want to tell you about are body cavities. And if you look at the picture here in orange, you can see that we have a posterior cavity. It consists of your cranial cavity, which is the space where your brain resides in, and your vertebral canal, which your spinal cord travels through. On the anterior side, or ventral cavity side, we have a lot of subcategories. We have the thoracic cavity. The thoracic cavity and the abdominal cavity is bounded by, anatomically, by your diaphragm. Anything superior of the diaphragm is your thoracic cavity. Any inferior is abdominal cavity. In your coxal area, hip bones, pelvic area, we have the pelvic cavity. A lot of textbooks say that they combine the two. They just say abdominal pelvic cavity. So don't be discouraged if you read that they've combined them. Then, in the pelvic cavity, for the record, is below the pelvic bowl. When we start learning about our skeleton, I'll show you back here. Pelvic cavity is anything inferior of your os coxae, down in this region. Looking at it from an anterior view, we can see that the thoracic cavity is further subdivided. You have membranes around each one of your lungs, and I'm going to tell you about these serosal membranes and how you can think about them and their names, and knowing their names tells you which cavity we're talking about. There's also membranes around your heart, and those membranes have a potential slit-like space between these two membranes I'm going to tell you about. That's the cavity. Each cavity around each lung is called your pleural cavity, P-L-E-U-R-A-L. The cavity around your heart is called your pericardial cavity. Peri means around. Then there is a space in between your lungs and superior to your heart. It is not surrounded by these serosal membranes I'm going to tell you about, and it is called your mediastinum. In your homework packet, there is a question or two that asks you what structures can you find in your mediastinum. You can find your esophagus, you can find your trachea, you can even find an endocrine gland called your thymus. Now let me tell you about these membranes and how they are anatomically situated. We have walls in this room. We do. And these walls separate us from adjacent rooms. Of course they do. If we were to break through these walls, what would we have to break through first to get into the other room, not using the door, if we were doing demo? What would we have to break through? Do you know what a wall is made of? Drywall, good. So we have drywall facing us, right? This is our organ. This is our classroom. So we have drywall facing us. Then if we keep going, we break through that drywall, what would we see next? You break through the drywall, what would you see next? A cavity, a space, where the wires are, or beams, or maybe the random rodent, cockroaches. It is a potential space for things to be found. Then what would we find if we keep moving out? That's right, another wall. The questions are not going to get easier, I assure you. So we have wall, space, and then another wall. Okay, now replace the word wall with membrane. We have membrane, space, membrane. The membrane facing us, our organ, because it is on the surface of the organ, is called the visceral membrane. It is on the viscera, meaning the organ. These walls here are our visceral wall, our drywall. Now replace the word space with cavity. So we have visceral membrane, cavity, and then another drywall. That would be another membrane. Parietal, meaning it's closer to the surface of the body. Parietal. So we have a visceral membrane, a cavity, and a parietal membrane, going from deep to superficial. These are serosal membranes, which means they are producing a very slippery solution. It's derived from plasma. It is not exactly like plasma, but it is very slippery, and that reduces frictional rub. If you rub your hands together, don't you generate heat? Of course you do. Well, you have organs that are also moving, and they could rub up against each other, and that would generate heat, and that can cause inflammation and pain, and not to mention, if it's enough heat, it can denature proteins inside the cell. That is, of course, how we cook an egg. We put it on heat, and it denatures the protein in the egg white and the yolk. When proteins denature, they no longer can do their job. They can't do any of the cellular functions that they need to do. Protecting organs that move frequently is the important task of these serosal membranes. The fluid that they make, the lubricating fluid, is found in the cavity, a slit-like space. It's not very large. However, these membranes can get inflamed, and that means more fluid accumulates in that space. And that means there's now more pressure put on the organs within. That is a type of inflammation. When it happens around the lungs, we say it's pleurisy or pleuritis, both terms. If it happens around the heart, we call it pericarditis. It means inflammation, and it's painful. It's a frictional rub. And depending on which one your patient has, they will sit in a certain way to relieve that pressure, to relieve that pain. So they'll feel the pain in their chest, and you might think, oh, it's a heart attack. Well, you can rule that out. You hook them up to an EKG. You can rule that out. You can do blood work. That can rule it out too. But they'll sit in a certain way so that their heart is going to no longer be right in the middle of the lungs, and then that means there's less frictional rub. They want to sit like this. If it's the membranes around the lungs, we say visceral pleural membrane, the one that's tightly adherent to the surface of the lung. Pleural cavity, that's the space where the fluid is. Parietal pleural membrane, going more superficial, beyond the space. If we're talking about the heart, we say visceral pericardium. That's the membrane around the surface of the heart. Pericardial cavity, that's the slit-like space where the serosal fluid can be found. Parietal pericardium, going away from the heart, superficial to the cavity. We also have membranes around your intestines, and a lot of students think, well, why do we need these membranes, same setup, same anatomy, around your intestines? You don't really think of them as moving, but they do. They do move. They have motion. They have pendular swings. They have segmentation, which means individual spots in your small intestine. There is movement. So they need protection and lubrication as well. Same terms when it comes to the membranes, but different prefixes. Peritoneal membrane, peritoneal cavity. Visceral peritoneum, that's the serosal membrane tightly adherent to the intestines. Peritoneal cavity, slit-like space where you have serosal fluid. Parietal peritoneum, getting more superficial. Using more specific terms tells you exactly where you should be looking. If I say visceral peritoneum, should you be looking around the patient's chest cavity? No. You need to be looking in the abdominal cavity. Do you have any questions about that? Oops. Quadrants. And also, beyond the quadrants, if you look down abdominal regions, we're going to tag those on our big mannequins today. You have a right upper quadrant. This is all in your abdominal cavity. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Quadrants are good to have an understanding of which organ is in which quadrant, but they're pretty big spaces. If you look at the picture, you can find the liver in the right upper quadrant, but also the left upper quadrant. The apex of the liver extends all the way over to your left nipple. Apex, by the way, means pointiest part of the organ. It does not mean that it's the superior part. The apex of your heart is actually inferior. Again, it means point. When we speak of the apex of the mountain, it is the pointiest part, and it happens to be the superior part. But not all organs in your body obey that same system. Apex simply means point. The regions that we need to learn are smaller, and that means more refined, more localized for us to really get a sense of which organ would be in those regions. It's like playing tic-tac-toe. So on the models, in the abdominal cavity, you are going to put tape, 2 lines of tape going down, and then 2 lines of tape going across, like a tic-tac-toe. We have, for the center squares, we have epigastric, which means above the stomach. We have hypogastric, which means below the stomach. And then in the middle, we have the umbilical region. Below your ribs, chondros. Your ribs have cartilage. Chondros is the prefix for cartilage. Hypochondriac. There's a right, meaning below the ribs, and a left hypochondriac region with the epigastric in between. Then we have a right and left lumbar region, because it's by your lumbar vertebrae. Right and left lumbar region. And then inferior to that, we have a right and left iliac region. It's called the iliac region because one of your os coxae, your hip bones, the biggest one is your ilium. If you put your hands on your hips, you're putting your hands on your ilium. That's the bone that you're actually resting your hands on. So that space would be your right and left iliac region. Okay. Before we move on to more material, I like to give you an opportunity to, when we finish a lecture like this, you should look at your homework packet and start answering some questions. And I highly recommend you work together. Divide and conquer. I recommend that. It saves time. Talk about it. If you can talk about it, then you know it. Then after that, we're going to get our mannequins. We have small ones, those might be easier. We have big ones if you want to really make a good tic-tac-toe. And I want you to start labeling these quadrants and regions. I also want to label Plain Jane. Where is she? There she is. These cabinets are where we store our models. And at the end of the day, we put them back where we found them. So this table, when you're done looking at your homework packet, you're going to label the planes on Plain Jane. This table, I would like you to label the upper right and the upper left quadrant. This table, I would like you to label the lower right and lower left quadrant on one of the small mannequins. This table, I would like you to take one of the big mannequins and make your tic-tac-toe on the big mannequin. We have 3 of them. This table, same thing for one of the big mannequins, tic-tac-toe, and I'll give you more instructions. Same thing for you, tic-tac-toe. Then over here, I would like you both, these 2 tables too. I would like you to still get one of the small mannequins. And I would like you to use a piece of tape with using the Sharpie markers, and all the Sharpie markers are up there in the beaker. And you're going to put an arrow on 2 pieces of tape. And depending on how you point the arrow, you're going to switch it around. It could represent lateral. It could represent medial. Get the idea? Superior, inferior, distal, got it? Just do 2. And then when everyone is done with their labeling, we go around and we shop. By that I mean you go around and you take pictures of the models. And that way you create your own atlas with our models in the classroom. This means you individually at each table, you're not going to get the models independently and doing all the structures of a hit list. We can make good use of time. You'll get the hang of it, trust me. Okay, so look at your homework packet for about 15 minutes. You should be able to answer quite a few questions. Then we'll get to labeling. And then we'll move on to microscopes and tissues.